Cool. I think we can get started, Liza. And I'm sure if we've got other attendees, they'll join in um, during the session. So firstly, welcome everyone, and thank you for joining our webinar this evening, and for making time and taking time out from your evening. We know that this is often dinner time, so our plan, Jared and mine's plan, is certainly not to have a webinar death by PowerPoint, but really to spend about half an hour, 40 minutes chatting, 35 minutes chatting, and then really to also address any questions that may come through during the webinar. Maybe by way of introduction, I'll be one of the hosts this evening. My name's Ivone. I'm the Client Experience Executive at Healthbridge, and have been part of the Healthbridge family for 15 years. I have the privilege of working closely with my colleague Jared. Let him introduce himself. I think it's a privilege.
Thanks, Ivone. I'm Jared Krain. Like Ivone, I've been working at Healthbridge around 15 years, over 2 spells. I came back to Healthbridge about 2 to 3 years ago, specifically to work on the clinical platform, the new clinical platform that was launched. Yeah, I'm looking forward to discussing POPIA and just taking you guys through some advice around POPIA compliance, how an EMR can help you, and yeah, but over to you, Ivone.
Cool. Maybe before we get started, for those doctors that may have joined a little bit late and missed the housekeeping, so Liza, our digital brand manager, did have a screen up with some basic housekeeping, but I just want to go through that. At any points during the webinar, so we unfortunately can't see or hear you, but we do welcome questions. The more the merrier. So whilst I'm presenting, and then when I hand over to Jared, if there's any question, please feel free to pop that in the using the Q&A functionality, which, depending on how your Zoom is set up, it's either at the bottom or on the side or the top of the screen. And the objective is that we will do our level best to answer the questions during the webinar. There's a quick survey at the end of the webinar just to give us some feedback on the webinar and how you found it, and if there's anything we can look to improve. So if you do have a few minutes, we'd appreciate that you complete that. And we often find that when we host these webinars, we have doctors afterwards saying, but I had a question afterwards. Again, more than welcome to pop us a question on webinar at healthbridge.co.za, and we will get back to you ASAP. The webinar is being recorded, and Liza will be sharing that with everyone that's attending here this evening. Probably by tomorrow morning, she will make the webinar available. Cool. So with that housekeeping out of the way, let me just make sure I've covered everything. I think I have. Yeah, we like I mentioned before, we very, very pleased to have. I think we've got 50 attendees with us this evening, and also a mix of different specialities across different disciplines. I'm going to now share my screen, and Jared, if you can just let me know when you can see it.
Not yet. Cool, I can see it now.
You can see it now.
Yeah.
Cool. And Jared, if you can be my time check, I do like to talk a lot. So if I go over my 15 minutes, you need to buzz.
Cool, will do.
Thank you. So really from my side, we want to cover some advice on that we've been given from our legal advisors when thinking about POPIA and what it means for a practice. And then looking at also the patient volumes and what's happened with patient volumes since the onset of the COVID pandemic to now. and also the impact that the recent riots had on both practices as well as patient volumes. And then I'll really hand over to Jared, who will demo how a tool like our EMR can really assist practices in protecting their practice from the challenges that are being faced, and really importantly, looking at how you can protect your revenue. So Jared will make it more practical for us when he demos Healthbridge Clinical. And like I mentioned, Q&A welcome throughout the webinar. In terms of POPIA, so I think we all know this, and we all have the 1st of July well imprinted in our memories and our brains, and really the two acts, the POPIA Act, the Protection of Personal Information, as well as the PIA Act, the Promotion of Access to Information, are two sides of the same coin, and are two acts that work hand in hand. They're not new acts. They have been around, but as of the 1st of July of this year, it came into full effect. Like our business and your businesses, we were given time in order to prepare and to get POPIA compliant. And the D-Day has come, and certainly we've gone to great lengths to be POPIA and are POPIA compliant, as well as we've assisted many of our clients in terms of advice on how they can go about getting POPIA compliant, and that's really what I want to share with you this evening. And the Act is now governed. So the new thing is that we do have the information regulator, which is really looking at governing the Act. So that's the new thing that's really come into effect from 1 July. It's in full effect, and all businesses are being encouraged or urged to comply. In terms of the advice, so neither Jared or I are legal, are lawyers or legal experts. So we have gone and sought out the advice from our legal consultants and our attorneys. By way of example, we've engaged with Elsevier, who has really assisted us in looking at what are practical ways and what steps practices can take in order to start getting compliant. And that's really what I want to share this evening. We are also looking to have a more detailed webinar where we will be asking Elsevier to host the webinar, where we can do a deep dive into POPIA. However, if you do have questions that neither myself or Jared are able to answer, we will again reach out to the relevant legal advisors and get those questions answered for you. The big question, and many of our clients reached out to us, was, and ourselves as well, is where do we start? It was a daunting task for many of our practices. And the advice, and I just really want to share with you some of that advice that we've been shared with and we've been communicating to our, in terms of steps to take. First one being appoint and register an information officer with the information regulator on their website. It doesn't have to be yourself; it can be somebody, a staff member in your practice. And really, this is somebody who, should there be any questions relating to POPIA that your patients may have, that it is the appointed person that can then get feedback to whoever's putting forward a question. And then, if you haven't yet, take time out to think about what personal information does your practice keep, where are you keeping it, and importantly, who has access to it. There is the obvious information that practices have, which is patient records, but there is also other information that practices do have on hand. Things like, for example, if you outsource your staff payroll. So really, we encourage our practices to just take some time out and think about what is that personal information that you are keeping and who has access to it. Thirdly, update and customize relevant templates and manuals. And this, again, will, there are some very practical manuals available from legal advisors like Elsevier, she being one of them, that you can purchase. But there is no getting around that. There are your templates, like your patient consent forms, like a POPIA guide, that need to be updated, that you need to have on record, really, to protect yourself. And in the next slide, I'll cover which are the really more important ones that need to be paid attention to. There's just no getting around that. This investment needs to be made. Again, us on a corporate side, we too have had to do the same for our business. And again, we encourage our clients to just take their time to update and have the relevant documentation updated, and also importantly customized to your practice. Consider also third-party providers that you use, like practice management applications, and how are they being compliant? And it's certainly within your right to reach out to them and find out what relevant steps that they're taking. And then importantly, consider moving to an electronic medical record, and I'll really let Jared cover that when he does the demo of how this can be really beneficial to your practice in terms of really safekeeping and safeguarding and protecting your patient's personal information. 4 important templates and how to go about implementing it. So the start is making sure that you've got the right templates and that they're updated. And then it's the first step. And then from there, really looking at, well, how do we now get staff, your staff yourselves to comply with the relevant documentation. The first one is having a POPIA policy, and this is really a manual in place on how you treat personal information. Should one of your patients request that you have this available on hand that you can share with them. Second important template is the POPIA policy. If your patients do want to have access to their personal information. And this is where medical practices are quite unique. As much as the patient record, yes, it is the patient's record. There is also IP that a medical service provider has added to this, and we've encouraged our clients to have this policy in place, and how your patients need to reach out to you and what process needs to be followed in order to access this information. Importantly, and I already touched on this, is the patient consent form, really to cover things of how certain of their information is disclosed. For example, a patient in that patient consent, in your patient consent, things that need to be covered are like a sick note, that your sick note will include things like a diagnosis, as well as does a patient consent to receiving communications. This is something that can also be added to the patient consent form. Then look to have a guide on how you go about retaining your documents, how they are being stored, and how they are being archived. Again, nothing new to medical practices. This has been standard for years, but the advice is really to have a guide and a policy in place should your patients request this from you, that you can make that available. So it's really details the process. It stipulates how long you keep the patient records for, how you prevent unauthorized access, and how you manage the damage and unlawful destruction of health records. And really, this is where tools like an EMR can benefit practice substantially.
Yvonne, if I may chime in,
Yeah,
I
go
think,
for it.
the HPCSA has always had existing guidelines on safekeeping patient
Mhm.
data, making sure it's confidential. I think the biggest difference now is that POPIA is mainstream. So patients are expecting it, whereas before you wouldn't have a patient coming and discussing HPCSA guidelines on
Absolutely.
storage, but now you have them coming in and saying, how are you protecting me from POPI? Do you have a POPI process? Could I get my data if I need it? That type of thing. So it's definitely mainstream. And you mentioned the patients on that previous slide. It's really important to have
Yeah,
kind of that material for the patient.
absolutely. And the big question I think everybody asks is, what happens if we don't comply? From all the research that I have done, and again, the advice that we have been given is the information regulator will act on complaints and tip-offs. So there is nobody that is going around South Africa and auditing practices and issuing a compliance certificate. So to Jared's point, it is that disgruntled patient that may choose to lay a complaint. Enforcing the act is then a sequence of enforcement notices to address the issue. So certainly everything that I have read is that their premise is to identify and rectify the issue. However, if a practice, like any other business, chooses to ignore the notices and do nothing to resolve the problem, there are heavy administrative fines, and the figure that is being shared is that you can run a risk of a 10 million rand fine to be levied. We do have examples internationally where this has happened. Pretty much the same, where it's only when somebody raises a complaint that then it gets looked at that a fine is issued. So if we are to look at what's happening globally, we certainly can't be taking the POPI and it coming into effect lightly, and hence the effort we've gone to encouraging our clients to take the compliance seriously. Moving along, in terms of the patient volume trends and how we have seen COVID impact that. So from the onset of the pandemic, we have been tracking patient volumes. And I'm sure if you look back, you can pretty much tell the story of how your practice was impacted. So this is our data across all disciplines, and so Healthbridge clients. And really what I've done is plotted from the start of the pandemic and how patient volumes have dropped as we've gone through the different levels, as well as the different waves of the pandemic. What I have excluded from this graph is PATH. It would have distorted it because PATH volumes have obviously increased with the number of tests that patients have had to get done. Patient volumes, the biggest impact is we saw was over here during the initial lockdown. And then again, when we went into level 3, adjusted level 3 around the 29th of December, and were in our second. When we look back at our revenues, we've estimated that there is probably about in 2020 an 11.2 billion loss in revenue, just given the decline in patient volumes throughout the pandemic. We saw a lot of our smaller practices, so speaking specifically to our clients that were just not able to survive, a lot of practices moving to the public sector or closing, specifically startup practices that just were unable to sustain themselves through the low patient volumes. Also, we serve a double-sided market where we've got medical practitioners as clients, but we also work closely with the administrators. And certainly the information that's been shared with us is that we've seen members also buy down in terms of the plans that they've chosen for this year. The pattern is similar across different disciplines. So I've really looked at the GPs and the allieds, and we see very, very similar patterns. So you can see the dips. Here was the impact that was felt during the first the hard lockdown, and then again during the second wave. I haven't shown what happened with optoms. They were particularly hard hit, and our dentists, where their volumes literally plummeted to like 10% or even lower for the optoms, where we saw weeks where there was no volumes. They were seeing no patients. So certainly the patterns are similar throughout the different disciplines. Like many other service providers like ourselves, there was the introduction of virtual consults to really try and assist doctors in getting, if they weren't seeing patients coming through the door, how could they see it virtually? What we found is that there hasn't been a wide adoption. The main discipline where we've seen a take-up was in the counseling, psychologists really looking at using virtual consultation. And there's many contributing factors. The fact that medical aids were, reimbursing a reduced fee, I think certainly didn't help doctors take up or adopt the telehealth more widely. Having said that, and I just picked two testimonials from two of our clients, and specifically GP clients, where during the early stages of the pandemic, where they took it up quite successfully and found it quite easy to use, and as an option to not only get their patients to come in, but as an option to offer like Dr. Lee saying, reduces stress for patients as they didn't have to come into the practice during the pandemic. And then other doctors sharing with us that, now that they've adopted telehealth, it's not only helpful during the pandemic, but they're able to access, for example, patient records whilst they're still on leave, should they need to be assisting their chronic patients. So as much as I said, the counseling psychologists adopted it more widely, we have seen some small adoption, but yet successful adoption amongst our GP practices. In terms of the recent riots and how this has impacted practices, again, just a quick view on those weeks or the week that we saw the riots really having an impact on South Africa. And they happened, so this dip here happened, we saw a lag of about a week, and that's really because many of our clients don't send their claims in real time, as well as many practices were affected during the riots and were closed and unable to send their claims. So we certainly did see the impact. I guess the one positive is that we saw a recovery almost immediately in the weeks thereafter. The practices most impacted were our GP and Optom clients in the KZN area. Sadly, many of our clients shared with us. I was actually telling Jared, I went back and I had a look. When I say many, I think it is still many given the hardship that these practices face. So of our 3,000 clients that use our systems, we had 20 clients who really reached out to us and said, their practices were completely vandalized. And I think even though 20 out of 3,000 is a small number, to have this kind of destruction happen to your practice is absolutely devastating. And we had clients in KZN who reached out to us saying, my practice wasn't looted, there was no destruction, but I just wasn't able to open. These visuals are from a client of ours that's actually not based in KZN, but in Soweto. And sadly, their practice was completely destroyed. Their patient files were thrown all over the floor. It was a dispensing practice, and medication was completely taken out of the practice. So yeah, absolutely devastating. But I think true to the South African spirit, we have risen above it, and it's pleasing to see we've kept close with these practices, that they're back up and running. So really, from my side, just a little bit of, I guess, not theory, but a little bit of content in the form of the impact that POPIA is having and what to pay attention to from a practices perspective, and then how our patient volumes have been fluctuating during the pandemic, and then specifically, how an incident like what we went through in July had a severe impact on many practices. Jared, over to you.
Cool. I should be sharing screen now. Can you see?
Yep.
Move to EMR and digitize. Okay, great. Thanks, Ivone. Not bad with the time keeping. Only 2 minutes over. All right, I'm going to jump straight into it and focus specifically on the EMR and going the digital route. So I'll try to do this in about 15-20 minutes. I'm going to keep it really practical. I've got a little bit of information in the first few slides, but then we're going to just jump into it with some practical examples and what to look out for. So in the next few slides, I'm going to first cover why an EMR makes POPIA compliance easier and why it protects your practice from risk in general. So that what Yvonne's just covered with the riots, but just really anything that could happen to your files by way of natural disaster or fire, whatever it might be. And as I mentioned earlier, I think it's important to note that unlike in the past, patients are aware more than ever about compliance. POPIA is mainstream, and you're going to expect these questions from patients. Okay, so this is from an article that we've got on our website. A few key points that I'm going to quickly cover before we jump into it. Really, to summarize, before I even start, a well-adopted EMR gives you peace of mind. It's a safety net. It allows you to focus on your practice, focus on your business, and looking after patients. If it's well adopted and used and you choose the right EMR, you can almost rest assured that you're POPIA compliant. All right, so let's keep going. First off, control who can access information. One of the biggest liabilities in any system is the individuals who are using it. Storage of paper medical records makes this really difficult. The unauthorized persons accessing it, patients starting to ask questions around, who's holding their file. Any personal information, really, according to POPIA, must be protected from loss, damaged, or unauthorized destruction. The wording they use is really, it's an obligation that's created for the medical practitioner to take reasonable steps to protect it. This is really hard to prove with paper, to prove that reasonable steps were done. And it's not always about malicious or intentional acts to expose personal information, but it could be a patient file that's left on a table or a path result. But with an EMR, if it's in place and being used, you can control who has access to this. And in everything, there's a record of everything. The second point, encryption. An EMR, to have peace of mind, find an EMR provider who uses one of the major cloud providers. That's a question you can ask whether you use Healthbridges or someone else. Find out how the information is saved, where is it stored. The top tier cloud providers have the gold standard of protection. There's really layers of protection that's in place. Simply paper obviously can't compete with. But first off, it has to be cloud, not hybrid cloud, and some information is on the PC. And if you find you have to install things, it raises alarm bells. Get a true cloud EMR. An EMR helps prevent tampering. We mentioned before, paper records are vulnerable to this. They can also be altered post-fact. Reports can fall out, they can get misfiled. Again, when using an EMR, not only is the information protected and encrypted, but there's logins, and you can track any changes that are made. I will show you that as part of the demo. And as I mentioned in this point, a good EMR will give you a full audit of the patient. So if you've added a note, edited a note, who's accessed it, dates, times, users, all of that should be available from an EMR. Another really important question to ask when choosing a provider. Lastly, protect patient information from disasters. Paper can be stolen, misplaced. Going digitized can help this. Even when there's not riots and things, disasters happen. My sister's practice was actually burned down. Pure accidents, shopping center burnt down, and all her records went with it. Luckily, she was using a cloud provider. So this is why an EMR makes POPI compliance a lot easier. And as I said at the beginning, if you choose the right EMR, it'll cover these things, and you have peace of mind and a safety net, and that's really what it's about. Now, it sounds ridiculously obvious, but an EMR is only valuable if you can use it. It's only valuable if it's easy to use and doesn't hinder your process. A lot of practices, doctors are used to the paper file, and it is really quick and easy to use. I mean, you can have the greatest smartphone in the world with every feature, but you're not going to get the benefit if you can't use it. I know it's ridiculously obvious, but a lot of EMRs that are out there are really feature rich and clinically rich, but they're not easy to use, and they fall short there, and it's a huge burden to embrace it and take it on in your practice and move to a digital platform. So this is where I'm going to get a little bit more practical and just show some examples and some key points to look out for. Ivone, if I'm speaking too quickly, you can rein me in, okay?
Okay.
Cool. So the first one, work seamlessly with your admin side of your practice. So what does this mean? Now, people associate EMRs with clinical tools and clinical information, which is great, and they should be clinically strong. But if there's a disconnect between your practice admin, you're never going to be able to embrace this. So, for example, if I look at our product as to illustrate this, I can see now, as on my landing page, that there's 3 patients in my day. I don't have to create these records. It gets done in the PMA, and I have, the account gets set up in the PMA, and then the record gets automatically created on my side. I can see who's in the practice. I can see that Jared Krain, my wife, is due for a consult in 23 minutes. My consult was 7 minutes ago. I got a message from the admin person telling me that Jared had a COVID test that's negative, but he's not improving. I can see how long the consultations are. I can see I have a telephonic consultation here with Andre Smith. He needs a prescription refill. So I know I've got 10 minutes aside for that. I can be really quick, which is good because I have a heartburn consultation that might take a bit longer. There's also a to-do list. So if I look at my tasks, I've got a message from my admin person to say, phone Edna. She's asking about her path results. So again, it might seem strange to focus on the admin side of this, but I promise, we've learned by working with practices, we had the best success once we incorporated the admin flow of the practice into the clinical side.
Jared, sorry to interrupt. I know in the previous webinars we often get asked but what is this PMA? How is this information getting in here?
Yeah, good. Thanks. I kind of skipped over that. There is a PMA that the admin person would have access to. They don't see the clinical information in here. So it's the traditional practice management application that you'd expect. There's a calendar, there's accounts, there's debtors, there's reports. But the admin person create a calendar entry. They can check a patient in so they can see who's in the waiting room. And all of this reflects on the practitioner side. So they have a view of their day and what's happening in the practice. When you go into these files, and this is not a full demo, and I know we've only got 15-20 minutes, but there's little things that doctors have helped tell us, because we techies, we're not clinicians, but things like, I want to know if there's an outstanding balance, or I want to know if there's a note from my nurse or from the admin person, or if there's no benefits available. So Ivone, you mentioned the downgrading of plans. It's great to know as a provider that I can see immediately that this plan, they're out of funds, as an example, or what will and won't be covered. Even though that's all done on the admin side, it is pushed through to the clinical interface. So that's That is your work seamlessly with the practice admin. The next really, really important thing is everything in one place. If you want to move away from the paper file, you need something that's really simple to aggregate all that information. So if I had to click on, I'll use my file as an example. This is all dummy data, in case you're wondering, but I can immediately have everything relevant that's normally in the paper file in front of me. So for Jared Krain, I can see he rides mountain bikes. I must speak to him about stress. I've got, he enjoys golf. He had a hernia surgery, a broken clavicle in 2017. Immediately I can tell he's on Ventolin, Montiflow. And as I scroll down, I got a full snapshot of his history. So I can see that on the second, the patient called, he wants a repeat script of melatonin. I can also see the date I captured it. There's his previous consult. So he thought he had COVID. Turns out he had influenza. If I scroll before that, Jared's a bit of a hypochondriac. I've got lots of messages. I've SMS'd him from the system. So I can quickly send Jared an SMS and it'll appear here on the record. So when I mentioned earlier that everything is there in one place and it's auditable, you can have this timeline and see exactly what was done for this patient. The same with the previous yellow file. Again, the integration with admin. So the admin person would have scanned this in. If at any point I want to see the historical paper notes, I can open it up. Everything's in one place.
And Jared, if I can just add, because that's a question that comes up often, is like, how do I move from paper to digital? Like, I've got all these paper files, and what do I, what's that process that a practice needs to follow? Because
so the longer you wait to deal with reality, the bigger the price tag. So you got to start at some point. And what we've seen work really well, there's a few approaches that have worked really well. The one is a bit slower, but every time a patient comes in, the admin person will check them in. And if there's still a paper file, they'll scan it and then they'll archive it or set it aside to be destroyed. Or in some practices, they actually give it to the patient and say, we're moving digital, we POPIA compliant, here's your file, you can do what you want. Everything is now stored safely in the cloud. One of our specialists does that. That is the one way, so file by file. Another way is to actually hire someone to scan them in bulk. To just set aside a few hours every day, go through it and upload them for you. And you'll know as the provider when you open the file, here it is, there's the summary of the previous yellow file and you can open it and see it there. Now when I say all in one place, if you get a email for an example, so here is a email of a broken clavicle. It's top of mind because I've broken mine not too long ago. You can just drag it straight into here and you can upload the file and it's on the record. We've also integrated with Path Labs. So if I go to a patient file, Frank, who looks remarkably like me, you may note, if I filter to the lab results, wrong patient, let me go to Fred. Oh gosh, Andre maybe. There you go. He's got path results and I can open them here and they're from Lancet. These are just dummy results. But again, we've integrated all the larger path houses, Lancet, Empath, Pathcare for Mark. So the results automatically come in and they're on the file. And I mean, to make this practical, it's got to be really quick and easy. If a patient phones in and wants to quickly talk to the doctor, let's say it's Fred Light, you can quickly search for Fred. Fred wants to, Fred's hurt his back, he wants to take ibuprofen. You can see that you're on warfarin, not a great idea. You can quickly make a note and say, advise to use Panado for 3 days and then come back. Then call me back if in pain. And I can quickly add that to the file and now it is on the record. You don't have to go through a whole consultation process, but the difference here, and if we're honest, most practices when they receive a call from a patient, they're not going to go find the yellow file, open it up and write the note. Maybe, some really diligent practices do. But if you're out and about or you want to look at your path results on your phone, you can do that. They're all in one place, and you can email the patient, SMS the patient, and there's a complete record of this on the file, or patient comms, etc. In terms, so I'm already, I've mentioned everything in one place. I've kind of just touched on quick to use. Again, we are not doctors, so we worked with doctors. They're saying, make it easy for me to filter if I want to see all previous metrics, or quickly filter to any documents scanned or any lab results. It has to just be seamless. If I want to update any of the information, allow me to quickly click and add a surgery. Let me add my own surgeries, so I can simply go down and, well, that's a funny one. Let's just do grommets and add it, and it's on the file. And next time I go there, I've saved it and it's on the file that the patient had grommets. So we are biased to speed. Really, like, everything was designed in a way to make it super quick and not interfere with the consultation process. Lastly, support multiple ways of working. Another big thing, not every practice works the same way. Not every doctor wants to capture notes the same way. So without going into a massive demo, I'm going to show you like 3 examples of different ways to capture information. So I've started a consult here. The basic flow is very similar to SOAP. We have the symptoms, examination, diagnose and prescribe, and plan. One way, if you're comfortable typing, you can simply just type a note. Patient complains of sore throat, earache, whatever it might be, and off you go. So if you're comfortable typing, fantastic. If you have a tablet and you want to use a stylus, we have that functionality as well, where you can do free form notes, or you can access one of our preset templates. So I'll choose hand as an example, and I'm not using a stylus, I'm using my mouse. So I'm a little bit rough. Left hand, maybe I want to type some notes here. Sore thumb, whatever it might be, or ingrown nail. I can add, we allow doctors to add their own templates. So if you have a specific form you want to fill out. So that's another way of doing it. So you have the typing, you have the stylus. We've also worked with providers to help us with forms. So I can do let's choose COVID, it's topical. And you can have a conversation, and the patients, I have a fever. Are you coughing? No, but I've got some body aches. Any headaches? They might say, yes, started yesterday, and I can click yes. And if I want, I'll say started yesterday. And this is building up the clinical consultation as we go. And it'll also generate the claim, and you can send it off. And then the next time you access this file, again, as I've stressed this over and over, everything in one place. So as I can see here with the notes, I can see that the patient called for a sick note on the 1st. I can see which doctor helped them. So the audit trails there. Yeah. Okay. So I said a lot.
Jared, maybe the one, and I might be biased, but every time I see the product and the new things that have been added, I just think it's super cool. But that aside, you went quite quickly when you described, as you are adding this information as a provider, the claim is being created. Maybe you can slow down a little bit.
Sure. And show that step. Sure. So in the consultation flow that I mentioned, the symptoms, exam, diagnose and prescribe and plan, everything you would expect is here. So if you want to do a electronic sick note, a motivation letter, a referral document, a prescription, digital signatures on those items, that's all there, and it'll all be added to the file. What does make life easier is the billing information. You can have your own templates. So for example, this is again a dummy practice, but we have a flu template, an ADHD, acute bronchitis. This is, you can think of as like a bundle or a macro where one click will add numerous lines. So let's open the COVID one. It'll add the diagnosis, the correct IC10 code. A lot of these meds aren't correct, but you'll see it's got vitamin D and Zithromax and Fulvicap and Disprin, etc. So one click adds all of this, it'll get sent through to the admin. So again, that first point works seamlessly with admin, sends it off to the medical aid, and when the patient walks out, they'll know whether they owe money or not. There's an inordinate amount of work that was done in the medicine space. So for example, you have favorites, you have categories of favorites. So I could have my favorite antibiotics and they're there for me. I can have my favorite dosages saved. There's medical history, what's in the last 30 days that the patient may have been on. You can look for formulary information. You can look up pricing information. There's a history of medicines prescribed. So if at any point I want to see that, oh, okay, I'm going to give you Ventolin again, I can tick this and simply prescribe it. I'm not doing this justice because I'm going really quickly, but to your point, Ivone, a lot of this is templatized. You can click on one thing, it'll go through and save you time. And again, it's no longer in the shorthand in a paper file and different doctors at a practice doing it. It'll be a consistent layout to that file, to that record. There's so many bells and whistles. If I select Panado for an example, it has suggested dosages. So it'll tell me two tablets 3 times a day, and I can quickly say 5 days. Allow generics, whatever it might be, and prescribe this. Put it on a digital script and send it off. If you choose Panado syrup, it'll suggest based on the data we have what the dosage should be. And it's really, again, has to be quick. 1 tablet 3 times a day, 7 days, morning, evening, add to prescription, and you're done. Okay, I'm gonna pause there because it's coming up to 10:02. But if I could just emphasize, just 1 or 2 points, really ask those questions up front. Make sure it's cloud-based. How is it protected? Show me the audit of the information. How do I access? What happens if I leave the EMR? How do I get the patient information? What if a patient requests the information? Can I extract it? That type of thing. Find someone that goes beyond just the software, but someone to actually help you go on the digital journey. It's not a flick a switch and tomorrow you digital. There's some really simple sequence of steps to get to that point. Cool. It feels like I tried to say a lot in a short time. I don't know if there are any questions that are popping through yet.
We didn't get any questions pop through. Maybe we can just give it a few minutes. If it would be so cool if we could just have everybody talking to us. I think it would make it a lot easier. It doesn't look like we've had any questions. Often we get questions like, Jared moved too quickly. He needed to show you something else, but it doesn't look like that's the case this evening, which is good.
Cool. I see there was 1 or 2 comments. So there was a question around patient data and being able to extract it, which yes is possible, and it's definitely something you should ask about when you choose an EMR. That should you leave, can you get access to the information? If a patient requests it, yes, you can print it and extract it. We don't do sharing of clinical information across providers currently. POPIA is a minefield already without that, but there is the ability to do referral letters, and you can generate referring information and send it off as well.
We've got another question around not sick notes, prescriptions and pharmacy.
Cool. So most pharmacies accept up to schedule and including schedule 4. There is a concept of an address book as well in the system, just like you'd have with email. So you can generate a prescription, send it off to a pharmacy, especially if you work with a certain pharmacy in your area. You can also send it to the patient. There is a QR code on it. So there's often questions as to what that QR code does. You can scan it from a cell phone, and it'll confirm Without revealing all the patient and all the doctor's information, it'll reveal just enough to confirm the authenticity of that prescription or sick note. So it'll say, instead of Jared Krain, it'll say JA ***, KRA ***, saw Dr. Veiga-Moroldo or Veiga ... on the 9th of the 9th. So you can confirm that people can't take, again, it's another way to safeguard your practice. People can't take the sick note and just simply change the patient details, because that QR code contains the original snippets of the original that you can't disprove. And once you sent off the email, again, it's on the patient record.
I think we've got, sorry, let me just quickly have a look. I think we've got another one. What does the program cost per month as is EDI done at the same time?
Oh, I'm not seeing these, sorry. So again, that depends on the speciality and what type of a practice it is. So how many providers, which setup you take. I would chat to one of our business consultants around that. So and there's some additional features and functionality for specialists. So.
Okay, I'm making a note of the doctor that's asked, just to make sure we can get back to you, Dr. Baruch. Another question, how do I apply for chronic medication using the system? Great question.
Okay, so yeah, that is an awesome question.
Nice idea.
Yeah, okay. That is a good idea. So right now we've got a integration into Discovery. So if you've got a Discovery patient open, you can go straight into Health ID to do that chronic application. We don't have, not all schemes have online chronic applications, and not all are willing to allow integration to them. I think it's a brilliant idea and would make your lives easier. What I'd suggest now, though, is once that form is done, like I dragged a file into it, just literally drag the PDF or document into the patient record. So there's a record of it. You can also, when you add a medicine to the patient file, you can indicate whether there is part of their chronic medications or not. For Discovery in one or two of the other schemes, we show whether it is part of the formulary medicines as well. So if you are dispensing or prescribing a chronic med, it'll indicate the formulary too. Let's see.
Cool. Another question popped through. On average, how quickly can a doctor get up and running?
Brilliant question. So I guess it's how long is a piece of string? We've had some practices get up and running in a day. It's now, what I mean by that is they immediately start digitizing from day one and using an EMR for their consultations. The scanning of files, well, that depends if you have 2,000 or 20,000 files and which approach you want to take. So the approach where, as the patient comes in, the admin person scans it will take longer to be fully 100% digitized versus getting someone into your practice to help scan the files. But really, there's no reason why one training session and you shouldn't be up and running. We can the system, I didn't even get into this, but you can enable and disable certain things. So you might say, you know what, I want to get to using this in the future. We can turn it off. So you can simplify it to the point where you are POPIA compliant and you can digitize everything without having to do all the bells and whistles and then go on that journey to start using the fancier things. Like,
and maybe if I can add to what Jared, and he mentioned, when you're looking at an EMR, consider not only what the product has, but the journey of digitizing. Yeah. So my teams work closely with the product teams, and we've got client liaison officers whose responsibility it is to look after a client and to make sure that a client is optimally, and when we say trained, it's not just that the client knows how to use the system, but it's how best to utilize the system within the processes of the practice, as well as giving advice on, like Jared mentioned, I want to digitize what advice would you give me? What processes should we introduce? So we do have a team at Healthbridge that really works hand in hand with the product and helps our doctors on the journey to digitizing their practice.
Yeah, I think that's all the questions.
Yep, I think that's
cool.
That's it for this evening. Let me just see if there's that is it. I don't see anything else coming through. Like I mentioned, we often find doctors afterwards going, oh, I wish I'd asked this. Please feel free to. Thank you, Liza, for adding the email address, webinar at healthbridge.co.za. Like I mentioned also in the beginning, we will be sharing the recording during the course of tomorrow. And I think the last thing was, if you can just take a minute or two to complete the survey that our colleague Liza has popped into the chat, we would really appreciate it. And thank you for attending. We got 3 minutes to spare.
With any luck, my kids are asleep.
Yeah, Jared and I high five each other because we can both talk a lot. So
yeah,
thank you for joining us this evening, and we hope that the information that was shared can be of help to your practice.
Cool. Thanks, everyone. Thanks, Ivone.
Cool. Thanks, everyone. Good evening. Have a good evening.
Cheers. Thanks.
Bye.